I'm Iva Rrugia from European University of Tirana, and I'm presenting Misinformation and Stigma, Barriers to Sexual Transmitted Infection Prevention among Albanian youth. Let me begin by framing our discussion. According to World Health Organization, sexual health isn't just the absence of disease. It's about physical, emotional, and social well-being, and it must be rooted in respect and freedom from stigma and discrimination. Now, globally, sexually transmitted infections remain a major public health concern. We're seeing over 1 million new infections every day, with most being asymptomatic, especially in young people. In 2020 alone, there were 374 million new cases of 4 curable sexually transmitted infection. Chlamydia, in particular, is the most prevalent among youth in Europe. And when we look at Albania, we see that young people report significantly lower condom use compared to peers in countries like Italy, which raises concern for prevention efforts. To better understand the current situation, let's look at global trends. The data show that risk sexual behaviors often start early. Over 31% of youth globally report sexual initiation before the age of 14, and 1 in 3 has had multiple sexual partners. Condom use also remains a challenge. Nearly 27% of youth report not using a condom, a concerning figure when combining with the early onset of sexual activity. If we narrow in on Europe, the World Health Organization latest report shows the decline in condom use among adolescent girls. Between 2014 and 2022, condom use dropped from 63% to 57%. A reminder that even in high-resource regions, progress is fragile. Meanwhile, data from ACDC shows that sexual transmitted infections rates continue to rise across Europe, indicating that prevention strategies are falling short, especially for youth. Let's now turn to the Albanian context. While sexual education was officially introduced into schools in 2006, early data gives us important insights. Back in 2003, 34% of youth reported being sexually active, with the average age of first intercourse for girls being around 70.6 years. By 2012, we saw a median initiation age drop to 15 years. Despite this early onset, only 23% reported ever using condom. This gap between behavior and protection reveals an alarming lack of practical prevention, regardless of education policy. These statistics show us that while curricula may exist, their implementation and impact remain limited, and risky behaviors persist. In Albania, even though the overall number of HIV cases is relatively low, 95% of those infections are sexually transmitted, a figure that underscores the importance of prevention. Unfortunately, sexual transmitted infection cases in general remain underreported, making it difficult to respond effectively. And who is most at risk? Youth aged 15 to 24. Previous studies consistently point to serious gaps in knowledge, including misconceptions about how sexually transmitted infections like HPV or HIV are transmitted. Finally, the national surveillance system of sexual transmitted infections is limited. Without data, we are missing the foundation needed for targeted public health strategies. This study set out to explore one key question. How do misinformation and stigma shape the way young people understand and manage their sexual health? Especially, we look at three outcomes. First, their knowledge of sexual transmitted infections. Second, their preventive behavior such as condom use. And third, whether they engage with testing and healthcare services. By focusing on these three pillars, we hope to uncover which barriers are keeping young people from making informed and safe decisions. This cross-sectional study was conducted in late 2024 and included both public and private universities across Albania. We gathered responses through online questionnaires reaching 7,679 students. Our aim was not just to quantify sexual transmitted infection knowledge and behavior, but to examine where students get their information, what stigma looks like in practice, and how healthcare access plays into their decisions. To interpret this data, we used SPSS for statistical analysis, including chi-square and regression tests. One of the clearest findings in this study was the role of social media in shaping sexual health knowledge. About 36.2% of respondents report that social media was one of their main sources of information. However, reliance on social media was strongly associated with lower awareness on sexual transmitted infections and more inconsistent condom use. Statistically, this association was highly significant, which shows that misinformation on social platforms is not just noise, it has a real and measurable impact on behavior. This highlights the urgent need for evidence-based sexual health content to be made more accessible and visible online, where youth are already looking for answers. Another important finding centers on quality of sexual health education. Just 54% of students said that had received proper sexual education. Among those who did, nearly 89% correctly identified condoms as the best protection against sexual transmitted infection. But for students who couldn't recall having received education, only 61% answered correctly. This shows a clear link. Without structured education, young people are left uncertain, and uncertainty leads to risk choices. Formal education plays a vital role in sexual transmitted infection prevention, yet too many students aren't getting it consistently. Stigma also plays a strong role in how youth approach condom use. Our findings show that nearly 90% of regular condom users felt no embarrassment when purchasing condoms. But among non-users, 1 in 5 cited embarrassment as the reason for not using them. Statistically, this barrier increases the odds of inconsistent condom use by 2.5 times. This shows that addressing shame and stigma isn't just a cultural concern, it's a behavioral health strategy. Removing these social barriers could help young people adopt safer practices without fear or discomfort. Our final major finding centers around sexual transmitted infection testing. Only 11.4% of all students had ever been tested for HIV, and just under 90% of sexually active students had been tested for any sexual transmitted infection. When we compare that to youth in Western Europe, where testing rates often exceed 60%, it's clear that Albanian students have far lower engagement with prevention services. Interestingly, students who knew where to access testing scores much higher in sexual transmitted infection knowledge. This suggests that practical access is a key driver of awareness and prevention. Improving visibility and trust in testing services could be one of the most effective strategies for the risk reductions among youth. These results, based on these findings, we recommend 4 immediate actions. First, school and university must fully implement comprehensive sex education programs, not as option units, but as essential curriculum. Second, digital platforms are critical. Youth are online, and we need to meet them there with trustworthy information about sexual transmitted infections, prevention, and resources. Third, testing must be both accessible and confidential. If young people know where to go and feel safe doing so, they are far more likely to get tested. Finally, stigma reduction starts with healthcare providers. We must train them to engage with youth using open, non-judgmental, and stigma-free communication. This research was conducted as part of a national project funded by the National Agency for Scientific Research and Innovation, known as AKKSHI. I would also like to acknowledge my co-authors, Lumturi Mercuri, Cristi Cela, and Dionila Gabrani, for their invaluable contribution through the Public Health Research Center at European University of Tirana. Thank you for your attention.